Before we get started on our numbers for today,
This is an eyewitness.
today is April 1st, and usually on this day we have a state budget in place. And as we are speaking here today and discussing, the budget is not completed yet. The discourse is interestingly and kind of confusing in that regard, that it is about cutting of healthcare and healthcare services to counties and communities. And I just believe that at a time when we are facing a pandemic, that our state leadership is looking at cutting healthcare benefits to local governments that are delivering services on a daily basis and an hourly basis during this crisis is really outrageous and really needs the attention of the governor, the leaders of both houses, to look at the big picture, as I said yesterday, and understand what people are going through and pass a budget that is fair, does not shift costs to the counties in this difficult time that we're all facing. Let's get it together. Let's prove that New York is one and we can act accordingly and not do something that should not be done at this time. And cutting health care is the last thing we should be looking at. So I'll just leave that there for now and go into the numbers update that have presented each and every day. Since our briefing yesterday afternoon, we have 9 new positive cases recorded in Oneida County, which brings our total of positive lab-reported cases to 55. The active positive cases that are in play right now are at 43. 12 have been discharged from that. As I reported tragically yesterday, we had our first death. The total lab-reported negative cases is up to 383, with another 21 that were reported today. Total individuals tested to date since the beginning of this event in Oneida County, 651. 213 tests pending as of 12 p.m. This afternoon. There are 358 people that are still in mandatory quarantine. There are another 270 individuals in precautionary quarantine. The total that has been discharged from both mandatory and precautionary quarantine is 545. So as you can see, the numbers are growing, and the numbers are growing at really an alarming rate here in Oneida County. In the last 6 days, we have doubled our number every 2 days. When I was here on our briefing of the 25th, we had 15 cases, positive cases in 6 days, really less. We have increased that number by 40. That is why, as I go through some of the issues of today in terms of the actions that have been taken and the new actions that we are taking, it is how rapidly this disease is spreading and how it's spreading by different means, that why we're taking the actions, and we continue to stress the precautions each and every day that you've heard time and time again. It's from coughing, it's from surfaces, it's from contact and with individuals in closer settings that shouldn't be in distancing. It is a highly contagious virus that is communicable before symptoms occur, and that's important because that's about why we ask people to practice social distancing, but more importantly, stay home, to not congregate, to not go to each other's homes. It is all with that designed in mind, that this disease is spreading and it moves quickly, and it moves unseen. So just because symptoms aren't there, it still is moving. It's an important point as we go through the measures that we have taken and continue to take to reduce the spread, to lower the curve, but we know that those numbers, as expressed on the federal level, through the CDC, through the White House, and through the State House with the governor. Just to go through some of the recent actions, the campgrounds update, that all campgrounds and cabin colonies in Oneida County as defined by the Sanitary Code, New York State, will close effective today, April 1st, remain closed until July 1st. Any campgrounds or cabin colony which has camping cabins, camping units, campsites, or campgrounds currently occupied must ensure that are vacated by 5 p.m. on April 12th, 2020. This applies to places permitted by Oneida County. As of now, New York State campgrounds are closed until April 30th. I expect that to be extended as we go through this. The reasons: campgrounds are communal sites where people congregate. It's not safe. I'm trying to keep people safe. Those who use them as seasonal residences should stay where they currently are. I couldn't have said it better, and I don't think anyone has said it better than Dr. Anthony Fauci, who is the chief medical advisor on this at the White House, who said now is not the time to take our foot off the brake. It's time to hit the gas even harder and to accelerate. And that's why you need to stay in your homes and not congregate. I've discussed with other individuals and community organizations and schools the issues of parades and gatherings that are taking place. Now is not the time to do that. We will have time to get back together. We will get through this. But now is not the time for these type of gatherings. We should not be organizing mass gatherings or social events of any kind, even if they include people in vehicles moving through a neighborhood. It still does not guarantee the safety of every individual, and people are still going to move about. It is not very pleasant standing up here and saying that each and every day, but we need to continue to not congregate and to follow the advice of staying home. That's why schools are closed. That's why so many essential or non-essential businesses are closed at this time. That's why churches are closed. That's why other community groups and organizations are closed. And all that we have done on the state level and on the local level. The issue of playgrounds. I will be sending a letter to town supervisors and village mayors and school superintendents as well. The mayors of the two cities have closed their playgrounds and their parks, limiting them to only walking. No playground should be occupied by young people, by children, on the playground equipment. That's, again, back to my first point, that this disease is spreading through surfaces. We should not have your children playing in areas in which other children have been and playing and on those various equipment that are in playgrounds. So I'm asking that all of the towns and villages and schools restrict the activities to walking on their facilities and not on any of their playground equipment. In addition, in response to requests from first responders who do not want to who want to assist the community during this crisis by social distancing in their own homes. Many have indicated the request to stay elsewhere so they're not infecting their families during this crisis. Utica College has dedicated several rooms in the former Burstone House Residence Hall to accommodate first responders and healthcare workers in need of temporary lodging. First responders requiring this resource, please contact the Utica College Office of Emergency Management at emergt@utica.edu or 315-792-3472. And again, that's Utica College Office of Emergency Management. And the number and the website will be posted on our website as well. And again, first responders, healthcare that want to self-quarantine though, and while they're still working, and just be away from their families. And we'll probably be doing more of this as we go forward. It's been announced. I want to thank SUNY Poly for their work in the Institute in creating and working to print for the 3D printing of manufacturing parts for face shields that will be supplied to our local healthcare workers. Oneida County is a partner in that. The first robotic competition that was a casualty of a cancellation due to Corona, Oneida County had contributed funding to assist in that endeavor. Now that funding will be shifted over to assist SUNY Poly in creating these masks. Walmart Distribution Center in Marcy is providing materials as well. The face shields components are being printed 24/7. The 3D printing labs at SUNY Poly's Center for Global Advanced Manufacturing in Utica will be able to produce 80 face shields during normal working hours each day. And I want to thank them for their work in that. During this crisis, as in many other crises and throughout, the Red Cross is always a great partner and avenue for assistance. The Red Cross obviously needs, or the hospitals and the various providers need blood during this time. So if you would go to the Red Cross website, which is redcrossblood.org, you can find out what in your neighborhoods or in your areas are available and times for scheduling for blood donations. And we encourage those who are healthy and can give blood to do so as they have in the past in other conditions. Again, going through our resources, the Oneida County Mental Health Hotline at 1-800-678-0888 remains in operation 8:30 a.m. to 6 p.m. during the week, Monday through Friday. Our helpline, which is 315-798-5439 for daycare, emergency assistance, aging and chronic care issues. And then, of course, the Oneida County COVID-19 info hotline in the health department at 315-798-5431, which is operational each day from 8:30 a.m. to 4 on Monday through Friday, and 10 a.m. to 4 p.m. on the weekends. That hotline is between a separate line for providers, which is a different line, is taken nearly 700 calls, and the general public calls is well around 1,300 as we speak. And so our healthcare and our health department has been doing an outstanding job in responding to and dealing with those great numbers. The volunteer email address, I mentioned that yesterday we have volunteers delivering food, medicine, and other supplies to various people who cannot get out of their homes. The email address is volunteer@ocgov.net. Remember the Mohawk Valley COVID-19 Response Fund through the Community Foundation of Herkimer and Oneida Counties and the United Way of the Valley in Greater Utica, which is mvcovidfund.com. And they have raised a significant amount of money and have been moving grants out to individuals and families that need assistance during this very difficult time due to lost work and wages and the like. Again, continue to visit our website, ocgov.net, for important updates and as we can, and contact information, an archive of all of these briefings, as well as the informational videos that are from the Public Health, Mental Health, and Youth Bureau in terms of recreation and activities that can be done. Our senior shopping hours through Oneida County Sheriff Rob Mayshill's office for local businesses and grocers that have set up hours for senior shopping. The Sheriff's Office Home Alone kids' safety checklist as well is on that website. For those who have been tested, again, we will get to you as soon as we have your results. Immediately we will reach out. Please do not call about them. I have to say that people are adhering to that. We need you to continue, especially as more tests are being given. Please do not call 911 about worsening conditions or about test requests. That should be done through your healthcare provider initially. Again, testing is being done at the hospitals for those patients and those that are referred there that are the most severe cases, but also other symptomatic individuals who are elderly or have chronic health conditions that require that immediately. Please continue to support local businesses that have been deemed essential and are allowed to remain open. I know there's a great deal of those out there that we continue to ask you to support, and we will continue to do so as well. If you believe anyone's in violation, contact the New York State Attorney General's office at 212-416-8700 or labor.bureau@ag.ny.gov. We're going to continue this to state each and every day: no unnecessary travel, social distancing, do not congregate, stay at home, stop the spread. Again, I can't stress enough. Look at the numbers. The numbers are growing. They're growing in our own community, more than double every other day since last Thursday. These numbers are going to continue to go up as you see the number of tests go up. So you should not have visitors to your home. You should not go and see elderly people in mass or in groups or whatever. It should be limited to only those emergency visits that need or the need to get food or medicine to them. Young people especially, we continue to say this each and every day. You could spread the virus without knowing it. It is not symptomatic for days and can still be passed along to someone else in that time period. That's why it's so important to maintain these requirements that we put in place and to continue to complying with this order. Not doing so puts everyone at risk, everyone in your family, everyone you come in contact with, and that's why it's so important to continue to just do what we've been saying each and every day. Continue to practice proper hygiene, wash your hands, clean surfaces, do whatever is necessary in your homes and in your business that are open and wherever you are. Please do not, again, we put a statement out through our water treatment plant regarding do not flush the disposable wipes. We don't need another health issue on top of what we're dealing with, and that causes problems to the system that is filtering our water and handling the sewage system. So again, be patient as you go in grocery stores. There's no reason to hoard or food or paper products. There's plenty for everyone. Please be courteous, be fair, and be patient with your neighbors during this time. With that, I think I've covered a great deal in that time. Some of the new pieces, some of the issues that we continue to stress, and with that, I will open it up for Phil to ask questions for myself or Phyllis during this time.
Okay, first up today we have David Hill from the Rome Center.
All right, thank you. I have a question, probably one each for Tony and for Phyllis. I guess I'll go first on the county, whole county government level. Do you see at this point necessity to furlough county employees, either near term or as this drags on?
Well, I mean, go ahead. Do you want me to answer that at that point, David?
Sure, go ahead.
Clearly we have several, many employees working from home, several who are, who have maybe in quarantine for those other reasons as well. But we have not made a determination on furloughs at this point. It's something we've been discussing the last few days. We need to take a look at it. That's very difficult in the county system. It takes a lot of issues to go through, and clearly discussing with the bargaining units that are represented here and how we go about that. But we'd like to get through, and we've been using county employees in a variety of areas. We've spread them out. Obviously, as I said all along, all hands are on deck. People are in various different departments filling in for those that may be compromised for a reason or not be allowed to come to work. So we're dealing with it as best we can. We'll take a look at whether furloughing is something that we do, but I don't have any immediate plans for that right now. And you have a question for Phyllis, I take it?
Yeah.
Go ahead.
It has to do with the conditions that are known, or at least said by the CDC, to make people more vulnerable to the coronavirus, ranging from simply being in a nursing home to being over 65 to, having respiratory diseases, heart condition, diabetes. I know that in some of these indicators, health indicators, Knox County is a little less than ideal, and some were better. How does that do you have a sense of how many people are kind of in the more vulnerable category, and how does that fit into the planning and how it's handled at this point?
David, that goes back to the whole distancing and staying in and not trying to congregate, because as we know, I believe Oneida County is a high rate, and I don't have numbers for you today, but a high rate of people over 65. We have a high rate of obesity, diabetes, heart disease. We see that in our annual statistics and studies that happen. A lot of work is done on that end in our community for prevention of those kinds of chronic illnesses, which is part of our prevention plan in Oneida County Health Department as well, with our state partners as well. So you're correct in that we do have a lot of vulnerable people in our population. So again, just reinforcing that if you fall into that category and you're not in a facility, you might be over 65, you might have other underlying health conditions, COPD, respiratory issues, lung disease, anything that would make you more apt to not do well if you, contract a very contagious virus. And it could be COVID, it could be anything. And a lot of other comorbidities that patients have, it causes them, mortality easier than someone who is very healthy. Which is another reason why we say that maybe younger people, perhaps that get the virus, will be very ill but yet be able to survive, although we do know that there has been deaths around the country and other countries of young people as well. Those people that are in congregate settings, like a nursing home or adult living facilities, they all have their directives from state health and whoever their overseeing bodies are about how they distance, how they clean, how they contact with staff. So everybody is following their own guidance depending on where they fall in regulatory bodies for those agencies. Some are regulated under State Department of Health and some under other divisions. And it's sort of the same idea with children. There's different children's sites, and everybody has to abide by the guidance for how they clean, how they segregate, and how their employees contact with patients or guests in their facility. So I think the bottom line is, if you're not in a facility, stay home. If you are in a facility, your facilities are following their guidelines for prevention of any communicable disease. Is that good?
Yes, thank you.
Okay, all set, David?
Yes, Bill, thanks.
Okay, thanks. Next up, Jeff Mansky for WIDF.
Hey, okay, so the first thing quickly is the face shields that they're making at SUNY Poly. You said those are for local healthcare workers, A, and B, those are reusable, right, versus a mask, which you usually discard. at the end of the day?
No, I think that, even the masks are not, you're not supposed to reuse those too.
Oh, you're not, okay.
Yeah, so that's why we go through so many of them.
Okay, and they will be for like local healthcare
Yeah.
workers, they're not going downstate or something like that?
No, they're
Okay.
not, no.
Okay. And can you recap what is a restriction versus what is a recommendation as it relates to what you said earlier about campsites and playgrounds? I just want to make sure I'm clear on that.
Sure, campsites.
What is a restriction? Go ahead.
Campsites, we're restricting any activity or any permitting from them or at them from today to July the 1st. With those that have been located there now, I mean, they have until April 12th to vacate. So that is clearly an order through as part of my executive declaration of state of emergency under a health department order to close those until July 1st, and that's an order. The playground thing I'm sending, as I said, is I mean, people should not be doing it anyway. Let's put that out there first. You should really not be going to playgrounds with your children and having them play on the equipment because, again, surfaces pick up this virus, and we don't know, again, in the unknowns, it's better to play it safe in that regard. I will be sending, like I said, the mayors of the two cities have closed their playgrounds for that. There are still playgrounds and parks open throughout this county. The county does not have a park system. So in terms of the towns and villages, I will be sending them a request that they close all of those. And if we have to make it an order, we will do so.
Okay, thank you.
Okay,
I'm all set.
all right, thanks, Jeff. Next we'll have Harrison Grubb from Spectrum.
Hey, thank you. My first question is for the county executive. At the beginning of the press conference today, you kind of talked about the budget, which obviously hasn't been finalized yet.
Sure.
But you mentioned the potential cuts to healthcare systems for counties and stuff like that. You want to bring attention to this. Can you kind of just explain what that might look like for Oneida County, especially during this health crisis that we're in?
Well, I wish I had better answers on one. All I know is that they're looking at, cutting those services, and healthcare is a big issue that counties deal with through its Medicaid system and others. And when you cut the funding and and change the system midstream, especially during a time like this, it adds costs to the county, and that is cost to the taxpayers. But more importantly, when you're redesigning a system in the middle of a pandemic, which is the worst time to do it anyway, you are clearly directing, changing the whole scope of healthcare, and that impacts everything down the line. And that's where I think people, when they think about our cry about Medicaid and whether it's redesigning it, cutting it, looking at it, they think it only applies to that. It has an impact across the spectrum of healthcare because it impacts all of the way healthcare is delivered and how it's paid for, and that's an important part of it. And then those cost shifts then from the state on down to the county. We've seen it time and time again. Governor talked about it earlier this year that perhaps the cap would be moved from the county. There's money coming from the federal government, which they are holding back right now and do not want to send down to the localities like counties and that require it. So all of this is happening as we speak. We need to get what the federal government has designed is for a county in this state in terms of what the federal relief packages is about. A big piece of it is about Medicaid, and because we are one of the few counties in which one of the few states in which county governments continue to pay 25% of our Medicaid costs, we should be getting all of that, the 25%, and not have it handled solely by the state and just on the state's end. That's what the governor, that's what the legislature need to do. They need to move that federal relief down to us the way it was designed to be moved, not in order to fill a state budget gap. We're going to have major budget gaps as we go forward. We have them today. As we're spending more money, as less revenue is coming in from sales tax, from bed tax, from nation revenue. There's federal assistance out there that needs to be given to the counties the way it was designed by the Congress, by the president, and that needs to be moved and not played games with by closing a state budget gap.
All right, perfect. Thank you. And my other question, probably better for Phyllis.
Okay.
We've heard from the beginning, I know initial medical recommendations were you don't need a mask unless you have symptoms like a cough, sneeze, stuff like that. Now we're kind of seeing a little bit more of a debate happening. At this point, do you still think it might be too early to tell people that they need a mask anytime they go to a grocery store or other sort of essential situation where you would be surrounded by a lot of people?
Well, the mask situation is different for different reasons, and some of it is to protect yourself, some is to protect other people, and that's why there's the difference between surgical masks and N95s and those if you're caring for patients with COVID or without COVID. So to answer the question about the public is difficult because, you know, depending on what kind of mask you're wearing, you might be protecting someone else from your droplets. However, that person's droplets, if they are positive, is not going to be protected by your surgical or your regular face mask. So I don't think there's a defined answer to give you for who should wear what kind of mask. I think we go back to, you know, stay your distance, stay home. If you have to be out in a store or a pickup or something like that, I think you just maintain that safe distance away and continually wash your hands, and try not to be in anywhere close enough that you're going to get those droplets, because there's different protections for different reasons, and I don't think the general public's use of certain kinds of masks will help you in certain conditions.
All right, perfect. Thank you so much.
Okay, thanks, Harrison. Next, Carly Stone from the United Dispatch.
Hi, thank you. I have two questions, probably best for Phyllis.
Okay.
So my first question is in regards to the 12 cases that were previously positive that have now been discharged. Could you tell me a little bit more about what that means to be discharged and how that's determined?
Excuse me, yep, those 12, actually, we can say that they've resolved. So that we had 12 people that tested positive, that went through their quarantine period, that met the 3 different criteria that we have from New York State and CDC that determines when someone can come off their 14 days or more quarantine. So that means those people have gone through the entire process with their illness, they're better, they've met all that criteria, and they've been discharged off of their quarantine process. So they've resolved.
Okay, thank you. And then my second question, I might have missed it if it was mentioned, but right now, do you happen to know what the current number of hospitalization is as far as positive cases go?
Yep, we have 8 in Oneida County hospitals that are positive, and we have 2 remain outside Oneida County in hospitals that are positive, the same 2 we've been reporting on.
Okay, so that's 10 total?
Right.
Okay, thank you.
You're
That's all for
welcome.
me.
Yep.
Okay, thanks, Carly. Next, Rocco LaDuca from the Talk to the Town.
Okay, thanks, Phil. Congressman Brindisi issued a letter today that states he's calling on the Department of Health and Human Services to provide federal emergency funding as soon as possible to local hospitals here in upstate and central New York. And in their letter, they state that hospitals in central New York are facing workforce, personal protection equipment, and medical supply shortages. And as far as the PPE equipment. And I know yesterday we kind of discussed a little bit, or you made the point that we do have supplies, we're getting more supplies, and anybody talking about not having supplies, that's not accurate. Yes, here's a letter to a federal department saying exactly that there's shortages of these pieces of equipment. And I've been contacted again today by people expressing that despite what they're hearing publicly, that they're still finding themselves in these medical facilities not having enough masks, not using the proper masks for dealing with COVID patients, not having any N95 masks. So there might be a disconnect there. There might be a miscommunication. My question to you would be, are you aware of any masks, if they are being provided to these facilities, are any masks being stockpiled or stored for this time until there is a surge or a rush on the hospitals that they will have that equipment available?
Yeah, I go back to, again, we talk to the hospitals each and every day. We supply and we purchase equipment, masks, gloves, all the like. I think what everybody's dealing with here, Rog, is the anticipation, but you're going through these. Remember, you're not reusing. These are things that are not reusable. So while you can say that no one's stockpiling them, and I mean, we're buying more and more as we speak, and so are the hospital, so is the state in terms of passing it along. I know that, again, I hear about the healthcare workers across, the country who have called and said their hospitals are not giving them. I find that really, I know that, every case is different, I'm sure, and different things happen, but, the issue of equipment is not a problem. I mean, I know that there's a limited supply, I guess is the way we've said it. That doesn't mean that healthcare workers are not protected, nor to have the equipment. I think everybody, and I think what the congressman is referring to is, we're looking at more and more cases, and while we're dealing with COVID and everyone on the side of that has to come into those hospitals, there's other issues in the hospital of other patients. All of that is blended together. So more and more of those workers need those supplies and that protection, that PPE, as they move about throughout a hospital structure. So yes, they're going to need more. There's a shortage. Well, we've been talking about this from the very beginning. Nationwide, there was a shortage. There was a shortage of tests as it was first reported. All of that is what, doesn't mean that they don't have them. It means that they're preparing for the next step. It's what we do each and every day. So while, healthcare workers, I would say also to them, go to the CEOs in those hospitals. We've been talking to them. We've been supplying them. I really not sure why this is getting, to be to this level, but that's the best answer I can give.
Yeah, and I understand your comments on that. For whatever reason, there's individuals expressing that they're scared of being exposed to some of the viruses that they're caring for. And so whether there is limited supplies or things like that, I think clearly, again, like you said, it's an issue dealt with. And as far as I have one more question after this, just along those lines. You see a lot of news coverage of individuals either making homemade masks or donating supplies, and workers are saying they're not seeing those masks themselves. Do you have an understanding of if there's a big amount of masks that are being donated or created, I guess, for the purpose that they are getting to the right people and the right individuals to share them with the workers?
As Phyllis said, and we reiterate, in terms of the hospitals, they're going to accept the masks that are approved through the FDA and through the CDC and what they need. Those primary masks for those workers that are dealing with COVID on the front lines are N95 masks. Those are plastic masks that are fitted to them that are different than the surgical masks that people use or that the hospitals use in other circumstances. They're going to stick with those. I mean, the other pieces of healthcare and other workers, other masks are all good, and people are making them according to the specs. But the hospitals are dealing with those very specifics. We're providing them. The state's providing them. They're providing their own. I can't speak to everyone who's making them and whether they should go to a hospital. The hospital is looking for what is approved and what is required under, healthcare standards, and that's where it's a little bit different. If that answers it.
All right. Yeah, thank you for that answer. And one more question, and this probably would be more along Phyllis's line, or either one of you can decide, but it's been reported, and we're aware that there's a local medical facility that had a doctor that tested positive for COVID recently, and I know that there's another facility outside the county as well that tested positive. And obviously, there's the concern to have healthcare staff levels sustainable for this crisis. Is there any protocol or procedure in place that would allow healthcare workers that are exposed to a doctor or another healthcare worker that tests positive? Is there a protocol that allows them to continue to see patients, continue to work in a healthcare setting if they are not showing any symptoms at the time, but based on everything we're being told at that facility, they could be contagious? I think the county executive made references to that. It's an unseen infection that you can spread without realizing. So the question would be, in healthcare settings, should healthcare workers be allowed to continue to work in those places if they have been exposed to a positive COVID doctor or physician or medical worker, but yet they aren't showing any symptoms at the time?
Okay, so there's a lot of questions there, Rocco. So I'll start with if there's a person that tests positive in any facility, whether it's a doctor's office, a healthcare facility, a long-term care facility, as I mentioned before, there's a lot of people in different settings like that. If an employee tests positive, that they are working closely with the Oneida County Health Department to identify, first of all, that they had symptoms, they were tested, what their results are. We do that line list that we talk about all the time about who were those contacts, whether they were patients and or clients of the organization and or they were staff members that were exposed. There's a whole bunch of different information that we ascertain from them, like what is the contact really? How close is the contact? When were the days of contact? When did you work or be a patient of that person that's positive? So after that's all determined, then we know who those people are that will be monitored and isolated and who isn't, that could just be aware of if they come up with any symptoms to identify and let us know. The answer to the question about can healthcare workers or any other type of facility worker return to work, there's a whole state health department guidance on healthcare workers returning to their jobs and the criteria they have to meet and be assessed for when they do go back to work and what their employers are required to do with them. So we work closely with them to identify those people and put those guidelines in place and work with the employer to make sure that that occurs.
So just to clarify one point there, if a medical worker tests positive, just because they've had contact or been around other workers that may or may not have been exposed but aren't showing any symptoms yet, so essentially they could be asymptomatic, that doesn't necessarily mean by just mere presence or contact that would require them to quarantine or isolate or be removed from the facility.
Right, so there's different kinds of contact, so you might be someone that was in a room 6 feet apart. You might have been in a room where both parties were masked. You might have been there way before the patient was symptomatic that became positive. So all of that data is collected by our communicable disease staff in Oneida County and the health department. And these are the numbers that we report to you every day about mandatory and precautionary quarantine. So many people are out on quarantine based on those determinations if they met certain criteria to be exposed to someone. That could be in a home setting, it could be in a work setting. That's why those numbers are so high. And again, we go back to the reason for isolating and distancing, because our spread of who we come in contact with on a daily basis is a lot. So it's not the same answer for every single person that you might be thinking there's one answer for all. It definitely depends on the criteria that were met, the patient that was positive, the case that was positive, who those contacts were, how they were contacts, and what time frame they were contacts. And then all those people are notified by their employer as well as the county health department. We monitor and track those people. And when it's time for them to be off their quarantine or isolation, we work with the employer to get them back to work. And if there's any rationale as to why they can't, that's separate and distinct, and we would contact the state health experts on those kinds of things in communicable disease if we have certain questions. The other thing, it's important for you to know that when there's a healthcare worker that is a positive COVID case, we communicate with our state hospital communicable disease, our state health department communicable disease partners on all healthcare workers, and we track all of the people that have been exposed to them, especially if they have been out of our county working perhaps. So the state health department notifies those other counties where those people might have been. So there's quite a tracking process for that.
Right. Okay, all right, thank you for your time on both those questions.
Sure, thank you.
Okay, thanks, Rocco. Next, Ed Harris from the Observer Dispatch.